This is part 3 of our webinar series. Today, we're going to be talking about, obviously, generational differences, and also looking at kind of similar traits and the best way to really align your communications with the target audiences you're going after. So I think this is it. This presentation has a lot of information about multiple generations, and also looking at not just outward facing communications, but also inward facing. So when you look at your workforce, it's also looking at that too. So we're going to break it down from workforce communication to patient communication, to also the community and potential patients, in looking at that. And then, as I said, look at multiple generational markets, if you want to say per se, that taking it step by step to say, okay, what are the best ways to communicate? So let me just dive into things right away and get things going here. With that, bottom line is we have to communicate to the individual. I think of anything, when you look at generational communications, it really does go down to meeting the expectation, personalizing your message, and aligning that content with the interests and the preferences of that individual. Now, with those differences, they can be everything from how they behave, to it could be a message that motivates me. That is a different. It's different for each individual. I think for everybody that's on the line right now, something that motivates one may not motivate another, and that can be driven for a lot of reasons. And then also, how are we going to get that message out to them? What is the best form of communication? Is it, when I say that, that's where I'm talking about. It could be traditional forms of advertising. It could be digital. It could be face-to-face communication. It could be education. It could be a number of different things. And we'll touch on each of these as we go through this. So let's first break it down. Who are these generations? The traditionalists, that 1928 to 45, obviously these are the aging, adults at this point. That this generation is unfortunately starting to fade a little bit, but they are your older patients. Many of these individuals probably are retired from your organization, but it's not to say that they're not volunteer workers that you're at your organization too. So, but they are the aging demo. When we look at this, I think we can all agree that they are the ones that, if a doctor told them something, they're going to be the ones that listen to that. They're going to, that word of being directed with their care that they receive, that was a credible health professional in their eyes. That is the doctor telling me what to do. But they also respect the quality of service. When they're making their health care decisions, they are looking for quality care within that. So that's the traditionalists. When we move on to the boomers want to be much more engaged. And with that, they actually, they're open to two forms of communication. When I said earlier about the traditional advertising, but also they go online for their health information. So they are the types that they're the first generation that really started to dive into online ratings. Last week's webinar talking about reputation management, that's important to them. It really does influence their decisions in regards to the care that they receive. You have to think about that internally again too. If I am seeking out a job with your organization, the reputation is important to me. That what you stand for is important to me. Gen X want to feel connected. Now this generation is they're kind of the ones in the middle right at the moment. The decisions that they're making for their healthcare are not just for them, it's for their parents, because now they're becoming caregivers and making those tough decisions at times about, obviously, number one, I've been caring for my kids, and all of a sudden, as my kids are growing, I now need to care for my parents and make those decisions of the care that they need getting them to re-engage with their care at times too, that they may have, gotten comfortable with it. They're not going to the doctors often, but they're starting to do it because their health is needing them to. So how do we get, connect with this generation to realize that it's important that their parents seek the care they need, preventative care they need, and also to continue to provide their children with the care or provide their children the insights that they need to provide the direction of that care that they need. Convenience is important for them. And if you go back to the traditionalists who were dedicated to that doctor, the Gen X, not as dedicated. They're going to look for options out there. And I think in anything they do, you can relate that to saying, if we're going to buy something, they're going to go out there and they're going to shop around with what they're doing. So they're consumers. Patients are consumers. So millennials, instant information, instant gratification with that. The cell phone in hand. This is a generation that hasn't known any difference from what they remember. At least growing up, they started, especially the latter portion of the, when you look at the kids that were kids. Yeah, sorry, they're not kids anymore. These young adults that were born in the 90s. Yeah, cell phones, mobile devices, how they communicated, the platforms they communicate on. This is just part of their life with this. So, but what that does is it brings, as you look underneath that, it's a passive form of communication. It's instant, but it isn't face-to-face. With that, you're getting a lot of peer-driven decisions, what my friend says, what we've heard online, what it might be. And we're also, this generation is affected by cost. They are looking for cost-effective, they're looking for deals at times. I'm gonna go to Amazon, I'm gonna find that deal of what that is. So the newest group to enter the generations is Z. And with that, they are the influencers. They're the ones, it's kind of cool. They're going back to the personal experience. They like, the millennials, as I said, they were kind of disconnected with this. Not to say they're all that way. I kind of got in trouble at the office yesterday when I was kind of going through this, and they're like, hey, that's not me. And I'm like, I get it. I know it's not you, but that's fine. But when we look at the influencers of the Z, they like the personal connection. They are the ones that they're looking for a cause. They're still making their health decisions, though, digitally. And they are turning to family and friends for the answers in which they do this. But they are much more, as you can see, they're volunteering, they're reconnecting, distancing a little bit more from the mobile life and wanting to get back to the face-to-face conversations. So it does change, but at the same time, it kind of opens up old ways of communication too. So I'm going to go back to the millennials here and kind of go back to what was on screen previously. When we look at this, they are the largest generation right now in the US. I'll give you some data in just a second. But with that, tech savvy, price sensitive, as I said, convenience. They are trying to balance their work life with their personal life, now raising kids potentially with this, and just wanting to have that, even though I said they're connected, they are starting to recognize that there's more to life than just that. But they're not committed to a single institution or a store or whatever it might be. They are going to that brand, oops, wasn't supposed to use that word, that image loyalty, loyalty to your organization may be hard to come by. And think of that also as retention to employees too, that they may not be as committed to that. This is a stepping stone for them to the next opportunity and the next opportunity and the next opportunity. So what are you going to do to create that retention, to be able to hold on to them? And as said, I already mentioned about what they're driven by. So when you look at it, 33% of millennials right now, according to the advisory board, do not have a regular physician. So what are they doing for their healthcare? Well, could be urgent care. So it's really more at time of need. You know, compared to that older demo that drops it in half to 15%. So there's an opportunity here when we look at this that within healthcare, if you're not focusing on millennials, it is a piece that you should be focusing on for that long-term growth of your organization. So within your plans, as you're doing this, you know, again, we've kind of gone through, as I said, last year we had Planning 101 within the webinar series, you know, how to set objectives, how to set goals, that was within there. So again, encourage you to go back, you know, we'll get you the link again, potentially, as we're sitting here. I know the last couple we've sent you links to past presentations. So, but in setting your plan for the future, your organization's plan, and whether it has to do with the strategic plan or how your marketing plan aligns with that plan, we need to look at the opportunity for increased market share within potentially that population if it matches a service line or even just the growth of a community itself. And we have to look at that sustainable growth, because the opposite end of the older generation that is now either retiring or that patient base is shifting, we need to backfill that. We need that sustainable growth. So we have to look at opportunities. And with that, when I say about strategic, your strategic growth plan, it could be even identifying, looking at the community needs of the future and identifying services that may align with that population. I know that Z is out there, Z is up and coming, but millennials are the ones that you really got to start thinking about with that. How do you do it? A good start could be really looking within your footprint of doing some millennial research, finding out what the consumer wants. Yes, I said about the fact that the consumer needs, but hone it down to the level of the millennial, to that population, to see truly what is the need of that population. What is it for themselves, for their families? Yes, when I said previous generations are now, you know, the Gen Xers are starting to take care of their parents, millennials will be there. So we have to start thinking about a foundation of that and them engaging in their healthcare before we get to that point. So when it comes time that they're taking care of their parents, it's an easier transition to that also. So the next point is last week's presentation. It is really the reputation of your organization to the millennial generation. I think it's to any generation, but if we're doing research on that, we want to have an understanding of what is your reputation of them. Is it positive? Is it negative? What can you do to make it positive within that? So, and then we have to think of beyond the communication piece, because that previous one of reputation may be driven by operational and cultural changes within your organization. How you provide care, who's providing care, how you work together to provide that care. Another way to get to know, I think for some of you, you may have advisory groups, but again, this is an opportunity to bring it down to just a certain population, that you have a hand-picked group of volunteers, could be internal or external, you know, as far as the people that work at your organization or outside your organization, and have them be kind of that go-to source that you could survey about different things, really get their understand, you know, from their perspective, what is your reputation within this? As you bring new things to light, what, you know, we can get an understanding of their thoughts, their behaviors, and actually build programming around that, or start to establish, even with this group, they can be the future ambassadors of your organization. Going back to reputation and that online management, these guys, this is the population that can drive that positive 4 or 5-star rating can be coming from this group, and how they influence their friends and family within that. So we want to get those numbers up, especially if you've established, as far as having that transparency on the site or through Google, having transparency. This is a great opportunity to add to what we said last week in regards to pushing positive online reputation management. So these are the audiences that I talked about right at the beginning. I'm going to take you through each of these right now. I guess before I jump into this, were there any questions as we go into this? Go a little bit deeper.
Yeah, I haven't seen any come through the chat.
All right.
But yeah, feel free. If anybody does have questions, we'll give you just a second to unmute. I'm just fascinated by this information. So I love it. I'd love to learn more.
All right. Well, let's dive into this. We're going to really kind of break this down. So let's look at the workforce. Right now in your organization, potentially you have 4 generations working together. With that, when I talk about that surge of millennials, it's expected that, right about now, we have the projection that within workforce in general, there can be up to 50% of your workforce being millennials. What does that equate to is when you look at the numbers of 2030, population-wise, 22 million boomers out there. I mean, 22 million millennials, that they're outnumbering these boomers by 22 million. So what's happening is that the boomers are retiring. That shift that's occurring. There's actually quite a few that already have retired. Yeah, I'm a boomer. I'm heading that way. It's not right away. And if Mike's on the line, I'm not retiring yet, so don't worry about it, Mike. So diversity is the result of that. And when I talk about diversity, it's a diverse group that's working together. When you have multiple generations working together, what can occur within that is differences. A number of differences can occur. They can lead to frustration, conflicts. It can be a communication breakdown. But ultimately, we don't want that to affect patient care. So as you're bringing in a younger generation into your workforce, how does that affect the existing base of workers that are there? With that, when I said at the beginning, we need to align our communications, we have to communicate to them differently at times. And sometimes we need to, this is the opportunity to bring them together because of the diversity that's there. With each of these that I'm going to take you through, I'm going to on screen kind of bring up kind of the high level, what are the ways that we can communicate? Thinking back to those first slides, that obviously email communication works for 4 out of 5 of these, where face-to-face is probably better or actually having that opportunity to collaborate is better. So as you go deeper and we talk about ambassador programs, bringing our employees together to listen to them, much like an advisory group, to work together, to be able to come to solutions as teams to this, which I'll touch on, which again leads into planning and brainstorming sessions. Do it together so that we hear directly. And yeah, it's pushing it for the Gen Xers that may not want to, I don't want to be out there and actually telling you what I think with this, but we do need to have that face-to-face collaboration to succeed with this. Social media, again, kind of shifts to the latter 3. Roundtable discussions kind of shift to the first 3 a little bit. So what are the types of, when we talk about this? A basic piece is just pairing the young with the old, looking at both sides of it, mentoring. So when you're looking at departmental situations, mentoring the young individuals with the older, the established, the ones that have the experience, the understanding of what is occurring within the organization. But the younger is going to bring a new thought way of doing it, kind of break the way of doing it, challenge it. But at the same time, somehow we got to bring it together, that there's an understanding of why I do it this way and why I do it that way. and try to bring it together as a single new way of doing it. So again, we do not want the patient to get caught in the middle of this. So with that, nor do we want that we have a really good employee that we brought on, a really good physician, a really good whatever, whoever it might be. And we just lost that individual because of others that we're not working together well with that. Satisfaction, internal satisfaction is not there. So how do we do that? How do we foster that? Well, within a good way to do it, and you can kind of see this off to the side, we've worked with organizations this way, that you bring them to the table together. You do planning sessions together. You bring that professional development piece together with individuals from all levels. It's not just leadership development. It's all levels being brought together, whether it's brought into through a department or it's done with core individuals that represent the entire organization, coming together to really set the growth future for the organization, new ways of thinking, and have leadership hear about it too. You know, that it's not, you're not just doing this on your own. Leaders are listening. Leaders, much like an ambassador program, they're connecting with their staff and they're having an understanding of this is what, oh, okay, this is what's going on. And they're solving this together if there is a problem. Otherwise, they're driving the ship in a direction that you may not even thought of, that it could be a new way that your organization could be going. Social media network connecting with staff, obviously with that. I think we were all driven, whether it's social media or Zoom or whatever it might be. We fell into this in 2019. The connection started happening virtually with staff as a whole. So communication, it did bring individuals into a platform that they may not have been comfortable with, but it's becoming a mainstay with this and probably won't go away. We don't want to lose the personal touch, but at least we're getting the voice to voice and not just a bunch of emails going back and forth. And as said, including people within your planning process. What does it do ultimately? It's trust, it's transparency. It's really feeling like you're part of something. And when I talk about retention, that is a huge part of it, that I'm a part of what's happening. And it's just not an email coming through on that. So by doing that, bottom line, come together as a team. That's what we want to do with this, you know, when we look at your workforce. Recruitment, with recruitment, and we're speaking to going to, we got to backfill. We also have to think about how we do it. I do recognize that in your communities, traditional forms of classified ads and things like that are still a positive piece to this. But you also have to think about, if we are trying to reach out to a generation that is connected, yes, we can have those opportunities within our website, but how are we going to drive them there? Is it done through social media? Is it done through you know, some sort of Google campaign? Do we have a presence in other platforms like Indeed or other Craigslist, whatever it might be? Do you have a listing there? Because right now, when we go back to, again, we're looking for talent in many areas that even are just service-based talent that may be or have been part of the food service organizations, or working in manufacturing, working in other areas. And this is a great opportunity, great stability, great benefits that they may not have presently. So connect with them, get that information out digitally, and also make it easy once they arrive there. If I click through Instagram or through Facebook or whatever it might be, that I go directly to where I need to go, get the information I need to do, and be able to submit an application easily to just a single source, however that might be, so that it's, again, it's convenient. So that is the workforce. As we go from the workforce to your existing patient base, again, across the board, we have a lot of different ways we can be communicating, from traditional forms to online types of pieces. The online review piece that we talked about last week really appeals to the Gen X millennials. The boomers are looking at it, but they may not be engaged in it. But the Gen Xers and the Gen Xers and the Millennials are willing to put their information out there, provide that review, push that out. Again, it's no different that they're doing with anything else that they purchase online. They're giving their feedback, and they don't have a problem giving you 1 star. We don't want that. We want to overpower the 1 stars with 4 stars or whatever it might be. Ease of experience, they too are looking for that ease. And obviously, for many of you, you've implemented an EHR or EMR with that. What do you do with that? What sort of, how do you expand that so that the patient portal becomes that connection of communication beyond the face-to-face, to create more of a preventative approach to the way that they're receiving information on an ongoing basis, and they're turning to that, whether it's just getting the next appointment or it is looking at their MyChart just to find out information rather than having to pick up the phone. Again, convenience, ease. Social, pushing that information out there on an ongoing basis. Again, it's education. It's building more of a relationship. This one touches on not just your existing patients, it's also potential patients, because they're kind of looking over the shoulders and saying, oh, I like the way they talk, I like their approach, but it's feeding me health information where I need it. It's about me. You know, we're honing in on information. We're honing in on who that patient is, who that existing patient is, creating Facebook events, creating valuable content within your website to give another reason to go there through blogs, pushing people there. Okay, that's great for that up, you know, the youngers. But what about, you know, I'm now older than 50, or I'm 65. How are you going to connect with me? What are you going to connect with me? Look at that targeted information that you can actually mail out. You know, this is going snail mail. This is the birthday opportunity, you know, to encourage screenings for colonoscopies. With that, the Medicare Advantage opportunity, or just down to the basics of you've turned 65 and it's the Medicare wellness visit, that re-engaging with your health if you're not already with that. So health events are good across the board. People want to have that channel, you know, unfortunately they're not good across the board right at the moment, but they will be good across the board. You know, it can be virtual health events, though there are some that are returning to it. I can't say that. There are health events that are, you know, starting to happen. And then virtual visits, you know, it is that latter piece, but as I said, with everything that's occurred, it's now causing people to become more comfortable because you've done Zoom for different things. And if I can see my doctor, maybe that's a convenient way to do it. So that leads to telemedicine. You know, with this 2 years ago, even though many were entering into the platform, the usage wasn't there. There wasn't a reason. It was like, why do I want to do that? I want to see my doctor. Just leave it at that. I want to make an appointment. Why are you doing this? You know, then it became, I need to see a doctor. I need to go through, maybe it's physical therapy, or I just need to have some sort of a basic, almost urgent care visit with my provider. Having that virtual care option available. It doesn't mean, I know for some organizations, even the primary care physicians are like, I don't, you know, why are you doing this? I want to see my patients. Well, it is the opportunity to be able to offer an option when that option is needed with that. And whatever the service is, at least, again, it's giving whatever generation or whoever it is an idea of how they can do it. It can be a convenient way to getting that a quick appointment, or having a follow-up video chat with a provider on screen with that, whatever platform you're using. Convenience. This is a piece of how you're going to make a difference for the Gen Xers and the Millennials and the Zs, that I'm looking for a same-day appointment. And I can say, you may say, well, we have urgent care, or we have walk-in care. You know, that is a good option, but it may come down to Operationally, go back to what I said earlier, operational changes that could occur. Do you find that you have, through your millennial research, you're finding out that you have a population of millennials that are working Monday through Friday? They have a hard time taking off from work. Can I at least have a Saturday care hours for half a day that I can get my child in for a well child exam? Those are the changes that, again, millennials are looking for options. They're going to be thinking about, well, if I can't get it here, if there is another option available out of town, I may go, even though I have to drive, I can at least get my child in on Saturdays. And it is part of, I can go there. So we don't want to lose that opportunity. Think about those operational changes, access, being able to get to that. Now, it's not just as simple as that. Do you have the manpower to do it? And it may require additional support to be able to do that within that, so that you have a larger team potentially that can adapt to the hours or to a location that is closer to, that may only be open a certain amount of hours a week. The personalized experience that we talked about, it's not just, okay, we've made the encouragement that you need a mammogram, or we're introducing, like what this was, 3D mammography. Hey, that's great, fine. But we got to tell, not just 3D's faster. What else can we do? Is there something more personalized that can be there? With this organization, I really looked at the partnerships within the businesses that were in the community, identifying within the generations that this appealed to, or I shouldn't say appeal, that we were targeting. We also recognize there was a business in that organization, being the Lantern Coffee House and Roastery, that also sold clothing and apparel, which was a very popular location for shopping, coming and getting a coffee, whatever it might be. So we brought it together and talked to the retailer and said, would you do this if we provide you with the mugs? And we actually, we're basically bringing our two organizations together with this. So with a Mammo, you get a choice of a muffin or a mocha at this location. And here, take the mug with, and they'll fill it up within that. So it is something that's an experience now. It's not just, yes, it's giving them something, but it is something that you're connecting with, it aligns again, go back to that word, it aligns with an experience that they like. So it might be just enough to do that. The wellness visits, this is just an example, as I talked earlier about the fact that we need to re-engage. For many of you, as far as the toolkit we had done last year, we did have a section on Medicare wellness visits, and some pieces that are part of the toolkit that could be used within this. But they are some basic types of things that when I say re-engaging, some of these people are taking care of themselves, but it's a great entry point to have during that visit to really assess what's happening with that individual and potentially scheduling secondary screenings off of that. You're not trying to find things, but potentially this is a great opportunity that they're starting to get engaged in their health again, and that it's an entry point again. So the last area is potential patients. And with the potential, the digital, again, we've kind of talked about that with this. So I'll dive into that in just a second. The ease of experience, that again, they're looking for that access, just like the previous. Health education, as I talked about, is a great way to build that foundation of bringing potential patients, introducing them to your organization. Social media awareness, with that, yes, you have your followers, but also think about boosting that information to the non-followers. This can be educational-based information, or it can just be about the culture of your organization. But really think beyond, because your followers are followers. They're probably your patients anyway, or your work staff. So we want to go beyond that within social media and provide them with valued content that they all of a sudden say, yeah, I do want to like this and I do want to follow you. Print publications are still a very seen of value within rural communities. With that, being able to place out a publication that's not just about you, but it's about their community. And then broadcast advertising, bringing it down to the basics of traditional communications, is still there to build awareness of your organization's offerings, whether it's service lines, whatever it might be. It's still part of the mix that's there. Convenience, I think for some of you that may have been in past presentations may have seen this, but this is the idea that you're basically saving a place. Doesn't mean that you're getting, I know you may look at this and go, well, we don't want to block time. For the individuals involved with Rochelle, with their convenient care, what they were finding is that online you could say, well, this is the wait time, but when you finally got there, it was now double that. So what they did is they implemented this that basically said, save my place. It didn't mean that you actually have scheduled an appointment. It meant that I plan to be there at that time. Now, if you're not there at that time, actually two things occur. They remind you that you said you were going to be there. You can opt out of it, but if they are running behind, then they can text you and let you know so that you can adjust your schedule to that also. So it's a nice little, and as said, that was something that they went to a third party for with that application. Speaking their language, I think I've kind of said this, the Amazon experience. Again, we have generations that are looking for that experience. It's amazing. Every time we're involved with website development and we go through exercises with this to really try to capture what are organizations looking for. And at the end, we always say, give us like 4 websites that you like the experience that you go through it. And every single time Amazon is on that list. It is, people like that experience. It's got everything. And I think you and yourself can think about that. I'm going there to go look for something. It may give me other ideas. It's connecting to other things, and it's giving me those star ratings again. So I'm hearing what people have to say. So when you think about your website, and again, those star ratings and your reputation, they're looking for that experience, that interaction, the collaboration of others, what they think of you, and trying. So you need to create that experience. It's also, when you think about that, hey, Google, when I say, is my phone going to answer? What? Think about that within your website. Speak the language, because it's not what just they're reading, it's what Google's reading too. Google is finding your organization through, yes, sometimes it is pay-per-click, but many times it's organic. And especially now when you're dealing with voice-activated devices, it's searching for phrases and words within your site. So think of it that way, that as you're writing content, we always say, let's bring down the reading level. Well, yeah, you do need to do that. Don't speak at a high level, as I said, industry jargon. Bring it down to a level that they understand, but that Google understands also. When somebody says, looking for whatever it might be, think about that within that. I inserted this again, even though this is from last week. I don't know if we use these exact same slides, but the reputation piece of it for the potential patient is extremely important. They're looking at those online reviews, but they're going into your website. And if you can serve that information up to them, being able to show the star ratings of what your patients are saying, you're controlling a little of that, because it could be coming through surveys that you're sending, and those star ratings are being built on that. Offering the video piece of it, that they can get the philosophy and the feel of who that individual is on top of what others are saying about them. So all of that is being populated into the bio page of the provider within that. Those star ratings, here's a listing of the types of things, the averages in which these things can be built. Friendliness, concern about the patient, the discussions, the proposed treatment plans, the likeliness of recommending this care provider to another, really looking at that, and then on average, bringing those all together and giving the opportunity to give a quote within this. Recognize, again, not everything is going to be 3, 4, 5 stars. You're going to get some 1s and 2s. And again, you need to be able to drive the positive into these and really take advantage of that within that. The video piece that I just talked about is a very important piece within the websites. It can be bios, but it can also be tips on healthy living, really giving the wealth of information of education out there, being able to promote what's important to a millennial or to a Gen X or whoever it might be, or even an older adult, because it doesn't mean they're not online searching and getting this information. That, you know, that is continuing to rise as boomers rise, as, you know, all of a sudden these generations shift a little bit, you know, in regards to the usage of what medias they're using. So we want to have that presence and having that information out there and putting it as searchable content that was out there. They're not looking for you. They're looking for a health focused situation. They're looking for something that my knees hurt, my shoulder hurts. You know, going through a pandemic, I got heartburn. I got a lot of heartburn. I don't have GERD. I don't even know what GERD is. I have heartburn. My chest hurts. This is the type of stuff that I want to be able to go out there, and if I'm Googling it, you need to appear at that point. And yes, that's putting in, that is a pay-per-click situation, but you're kind of fishing out there for these patients that are looking for health-focused problems. And then you're pushing content that can be educational. You can get them to connect to a blog that may be talking about future information that again, you have that ongoing relationship until potentially, hopefully, the conversion starts to occur, that I am now going to make that appointment with that doctor that I've been seeing on screen that's been telling me what is going on with this heartburn all of a sudden, that I shouldn't be certain lifestyle things that are occurring, or how do I balance my stress better with what's occurring, whatever it might be. That's where we want to have that presence when they're searching for this information. Talked about the publication. As I said, these are the types of pieces that it's not just about your organization. It's connecting with the community, highlighting individuals in your community that are making a difference, highlighting individuals in your organization. Still, introducing services that relate to, it could be new services, building awareness of those services, of that, showing how you're part of the community, that you're a good part of the community, that whether it has to do, you know, really with anything of how you reach out and you're just community minded. That's what this is for. And they look forward to it then, that they recognize people that are down the street or coworkers or a family member that is like, hey, that is so cool you were featured in this. You know, we have with this, obviously, some of the surveys that we've done, that this became a key piece of communication. It didn't matter what the generation was. So yeah, if you think print is outdated, still there. Education, bringing your providers out into the community. Again, once you have the opportunity to, or bringing them into you, getting them to talk about things that, again, that could be common challenges that people are having right now, that not just right now, anytime, or generations that I'm looking at. Okay, I hit this age and I can't keep the weight off the way that I used to. I'm looking for a diet. How does it work? Or I'm also, if I'm a dietitian, maybe I can bring something out there that, again, I work crazy hours. I want to make sure that my kids are eating good, or that when I get home at night, we can eat a good meal. What are some good recipe tips for that? Or I'm dealing with sleep disorders. You know, things are just really challenged right now. And how do I, is this something more than just, I got something on my mind? Is there something, a greater sleep disorder that I need to be educated, that it's, maybe I do need to have a screening of some sort? So these are just trying to build the awareness, and to that potential patient, I'm saying this is potential patients. This is not pushing it out to this is going up to the community. And that may again be enough to be an entry point to say, I want an appointment with this individual, or I want to have that screening, or I'm going to go back to my primary care, I'm going to establish with a primary care doctor. And then as we lead into the end of this, diversity, it's still very important. And front end, I use the word diversity based on generations, but we still have to think about the diversity of your community, that the generations can be everything, but we also have to break it into, there's diversity in the individuals, their culture, everything. It all comes together. So, when we talk about generational communications, it's not just as simple as breaking it down that way. We also have to bring it together with really diversity as a whole. And it could be that means you're slicing it down one more chapter. Last year, we did break into more of the diversity of individual of color and culture and how that related to generational communication. So it is all part of that together. So what did we learn? It's being able to successfully master this. And it isn't something that you can just flip a switch. There's a lot of hands involved in this. When I went through all of that, we're talking, yes, it's the communications department, but it's also the leadership of the organization of where is your organization going in the future for the offerings that are being provided. It's also your HR department. How are we recruiting? It's also just the basic culture of your organization. How are we working together on this? If all of this can come together, that's how you're going to, as I said, you're going to thrive with that. But it is also recognizing that there are differences, and how do we communicate it's how do we communicate together with this? That we're stronger together with this. How do we come together and really become something it could even just be a unique way of providing care in the future. The communication methods, as you do break it down, and it's both outward and inward facing, what is the best way to communicate to who, and the frequency of that? How do we personalize that content so that it is something that aligns with really what I'm interested in? And with all that, it's, it is embracing our differences, but it's building trust at the end of the day. It's trust in your organization. It's belief in your organization. So whether hospital, clinic, it is that. So I know that's a lot of information, but I'm hoping that, today you were able to walk away with this. Now, obviously, this isn't just me. The sources that we went to with this information come from the AHA, the Advisory Board, AARP, Healthcare Strategy Institute, Modern Healthcare Predictive Index, and then also some research through Willis Towers Watson. So it is a lot, and it's changing. Obviously, the Generation Z, we really haven't dove into that yet, and that is something we do have to take a look at and go deeper into to provide more information. Maybe that's a future piece that we take a look at that.
And the question's in the chat, and it's from Amy Tucker. And she says, she asked, what are some examples of practices that hospitals have successfully adopted to engage the different generations internally? Anybody feel like they have, even if it's just something kind of small, it doesn't have to be a huge campaign. Even if you've done something that has, just you felt like have brought the different generations together. And you did provide a lot of great examples there, Brian, of, there's so many things about that the first thing that caught my eye was like the mammogram, going to, I would love, because if you're going to go through that, I'd love to get a mocha afterward. Nice little treat, that'd be awesome. I've having gone through that several times, I'd love a nice little treat after that. But and also just that mentoring process of, maybe a newer nurse with a more seasoned nurse, or, a healthcare provider of some sort. But an organization within one of our cohorts is Henry County. Is there anybody from Henry County on the call today that just kind of comes to my mind? in their Silence the Shame series that they did. I don't know if anybody's familiar with that, but it was a part of their behavioral health initiative that they had done within their community. And there's video series that they have done. It's just real life people within their community that have struggled with mental health and different aspects of that. But another thing that they did, which is, very relatable, but another thing that they did was they had some of, I don't even know what the name of the generation is, but the most current generation who are the ones who are making the TikToks, to do just a series of TikTok videos as well. I mean, I enjoy TikTok. I would not know the first thing about how to put one together, but I enjoy watching the content when I can find it. So, just another avenue to involve kids, our kids, and in a way that we can, just be involved. And I just, that whole series, and you can look it up, and hashtag Silence the Shame, TN for Tennessee, it was the hashtag that they kind of utilized for that whole kind of communication series that they did. And it was very well received and very fantastic. So if there's anybody from Henry County on the call, I'd love for them to, of course, speak more about that. But I just know enough to share the information.
Yeah, I would say that within, when we look at internal campaigns, and I hate to put it as a campaign, but really looking at it, how do we create, how we created some sort of an initiative that brought together the employees and at the same time pushed it out to the community so that they saw. And that was more of the piece of what we had done, where it was really looking at, when we talked, again, reputation wise, letting the employees talk about really how they love the organization, let them be the voice, playing off of each other, celebrating all of that internally, doing the celebration, but then pushing it out to the community. They see it too. With that, shifting it into your HR piece of it so that they see it when you're trying to recruit. Right now, I hate to be going back to the recruitment. I don't know how many organizations on right now are being challenged with this, but that's probably, when I look at over the last, the last year and a half, we went from the telehealth piece to all of a sudden a lot of physical therapy types of communications. Now all of a sudden we're shifting into recruitment, and the challenge is, so how do you, again, as you're doing things internally and you're coming up with those ideas internally, think about how they can go outside, and that positive vibe that you're creating internally, and that how you're coming together as part of this can be outward facing, whether it's done through video, TikTok, whatever it might be, so that as I'm looking in, thinking about that opportunity, that there is something in your organization, as I'm researching it online, that it's like, yeah, I think I do want to be a part of this. So it is different than just another classified ad.
Yeah.
Okay.
Great ideas. Yeah. Thank you so much, Brian. And I know we're right at time. So
we're at time.
Yeah, I do just want to, yeah, thanks, Amy. Amy says that was a great session. Next week, we'll have another great one as well. Excuse me. So on November 11th, same time, same place, we'll have, Mike will be presenting with us on physician relationships and building a referral network. So that'll be the 4th in this series. And so we're very excited about that opportunity. And today we'd just like to thank Brian again for just being with us. And we'd like to thank you all again for joining us. And yes, Veterans Day is the 11th. We will still be here though. If you get the opportunity to be off, we will record the presentation. You can watch it when you get back. Yeah, we'll still be here. But yeah, we'd like to thank you all, and just we wish you a great rest of your day and rest of your week. And we'll see you all again soon. Thanks for
Yeah.
being with us.
Thank you.